as Nicole said, my name is Allison Haight. I work in the City of Loveland's Community Partnership Office. And so our office exists to distribute grant funding to nonprofit agencies that provide human services to Loveland residents. And we also work with local partners to address affordable housing. We're here tonight, as you know, to speak about homelessness. So I wanted to let you know that we work with a large team of organizations in Northern Colorado, working to put people who are sleeping outside into homes. David will show you a list of our participating agencies in a few slides from now. The Loveland City Council has been discussing homelessness in Loveland for over a decade. In April of 2018, it was suggested by one of our city council members that we work to produce a strategic plan and look at what other cities the size of Loveland have done to reduce homelessness and to address the issue. So in late 2018, we hired Denver University's Burns Center on Poverty and Homelessness. And a year later, we received a very detailed report with a list of strategies that we could implement that were shown to make a difference. So our next step was to hire someone to help us. On September 30th of last year, 2021, Homeward Alliance signed a 3-year contract to work on overarching solutions that incorporate our current Loveland service providers to identify new services that could make a difference and work collaboratively toward a common goal with all of our providers of making homelessness rare, short-lived, and non-reoccurring. I'm going to give you a short list of some of the goals that we are working on to provide a functional system that helps people leave homeless. They are: 1, assisting Loveland agencies with a shared data system so that we better understand the scope of what it is we're trying to address. Another is we're creating a data dashboard so we can better communicate with you, the public, as we make progress. Offering technical assistance to create a street outreach team to get people who are living outside better connected to the resources that will help them get out of homelessness. They're working on, right now, creating a night shelter program and expanding day services as well. And they will work on helping people get and stay employed. Next, I'm going to turn it over to David Root. He's the Executive Director of Homeward Alliance, and he'll give you an overview of the systems that are in place, not just in Loveland, but in all of Northern Colorado. And he'll also provide some data showing results that we've produced since 2016. Next slide, and David.
I think this is the right slide, actually.
Yep.
The Resource Day Center and Overnight Shelter. So my name is David Root. I'm the Executive Director at Homeward Alliance, and normally I would be sharing this presentation opportunity with Sandra Wright, who is our Loveland Homeless Systems Manager, but she's out today, so I'm filling in for her on some of these slides. We were going to tag team it, but normally under normal circumstances, she's really our primary point of contact when it comes to lead agency work within the city of Loveland. So I'm the Executive Director at Homeward Alliance. We have been an agency for about 14 years and provide some services in the city of Loveland, but until the last few years have been primarily based in Fort Collins. It's only in recent years that we've sort of expanded our service scope into the city of Loveland and sort of regionally in general. And obviously with the addition of our lead agency contract, we're now really focused on homelessness response in the city of Loveland. And in addition to the technical work that we're doing, which really is what the lead agency covers, we're also hoping to expand our services in the city of Loveland and/or empower other agencies that are already on the ground in Loveland doing great work to expand the services that they're providing. So today I'm going to talk about a few different interventions that are sort of necessary parts of any homelessness response system. And I'm going to talk about both services that are available to people while they're experiencing homelessness and services that are available to help people escape homelessness and maintain housing. And I'm going to tie that in with sort of our overall region's response to homelessness and how we work together to collaboratively to make sure that that we are, as a region and as a community in Loveland, providing what we know are best practice solutions to the issue of homelessness. So as you can see here on the first slide, we're talking the first interventions that we wanted to discuss are a resource day center and overnight day shelter, or overnight shelter, excuse me. I think there are just a couple of things that I want to highlight here. With both an overnight shelter and a resource day center, and the idea would be to provide basic needs. So an overnight shelter, obviously the basic need there is generally speaking, providing a place for people to sleep. That's often combined with meals and sort of other basic services like showers and laundries. And then a resource day center also typically provides access to basic needs services like showers, lockers, laundry, mail, that sort of thing. A good example of a resource center is the Murphy Center, which is based in Fort Collins, but is Larimer County's current hub of services for people experiencing homelessness. So about 250 or so people who are homeless in Loveland actually access services at the Murphy Center for day center services on an annual basis, because the services are just a little bit more limited in the city of Loveland. A couple of key sort of distinctions between overnight and day shelter, and these are not necessarily steadfast rules, but just sort of typical things to think about. Often overnight shelters serve subsets of the broader population of people experiencing homelessness. So you might have a shelter for families, and you might have a separate shelter for, single individuals. You might have shelters that are gender-based. You might have shelters that are for veterans. It just depends on the community, the funding that's available, the interventions that are most appropriate to the community. But generally speaking, unless you have a really large building, it can be extremely difficult to accommodate all subpopulations of people experiencing homelessness at one overnight shelter. Key difference with a resource day center is typically you do cast a much wider net and try to provide services to a much broader range of people experiencing or at risk of homelessness. I saw in the chat somebody said they're having a hard time hearing the speaker. Was that me? That they're having a hard time, or did I miss that from a while ago? Just want to make sure. Am I coming through okay? Yeah, okay. I see Nicole give me the thumbs up. Another key distinction typically between a resource day center and an overnight shelter is that a resource day center will bring multiple providers under one roof to collaboratively provide services to everyone who comes to the building. So not that can't happen at an overnight shelter, excuse me, not that can't happen at an overnight shelter, but at a resource day center, you're operating during hours when businesses are open, when the places that, services that people commonly need to access, like, the Social Security office, for example, the DMV, when those sorts of services are open. And so just to go back to the example of the Murphy Center, and something we may want to replicate in the community, in the Loveland community moving forward, we have about 20 different agencies providing more than 40 unique services under one roof. So the idea is that somebody, rather than having to go from place to place to place to place to place all around town or all around the county, can go to one location, access services from a single site, and have staff members on site who can sort of help navigate those services. The last thing I want to emphasize, and then we can go to the next slide, is that both of these interventions, while often focused on a day-to-day basis on helping people to just sort of meet their basic needs and get by, particularly overnight shelter, both are crucial components of the overall homelessness response systems, and in communities that are making progress toward making homelessness rare, short-lived, and non-recurring. And we'll talk a little bit more about what that means later when I define functional zero, that communities are integrating their overnight shelters and their resource centers into this overall effort to get people housed. So yes, an overnight shelter serves a basic human need of providing a place for people to sleep, but it should also be an entry point, just as a day center should be an entry point, just as really everything should be an entry point into a system that's designed to actually help people escape homelessness. And that's a big change in the field that I think has taken place over the last 10 to 20 years or so, where overnight shelters, and I've seen it with our overnight shelters regionally, are just much more integrated into the overall strategy around how we respond to homelessness as a region. You can skip to the next slide. So street outreach is a good next thing to talk about, because while a day center and an overnight shelter will often serve the vast majority of people experiencing homelessness, they will not serve everyone who's experiencing homelessness. Street outreach teams, as you can see here, are mobile response teams that actually go out into the community where we know people are experiencing homelessness and engage with them in a much more proactive way. This is essential because not everyone can come to an emergency shelter. Not everyone feels comfortable coming to an emergency shelter or a day center. And depending on the sort of makeup of the different facilities, there could be some very good reasons. Just, to go back to the Murphy Center as an example, we've heard consistent feedback from families that they just in general do not feel comfortable bringing their children to the Murphy Center. And that's not to stigmatize the people who are coming to the Murphy Center and say that, everyone who's coming to the Murphy Center is scaring families. That's not the case at all. It's just that the building is rather small. Space is limited, and when you have a disproportionate percentage of people who are experiencing, mental health or substance abuse issues on a day-to-day basis, we hear from families that it's just not a space they feel comfortable coming. So, in addition to that, we hear pretty consistently that people who are chronically homeless, who have been homeless for many years and have a disabling condition, often prefer not to come to a day center or an overnight shelter. And a lot of this has to do with, there's a confluence of factors. It depends on the individual, obviously, but a lot of it has to do with negative experiences from the past and just sort of a distrust that these sorts of services are going to be able to help a person escape homelessness. Particularly if you've been experiencing homelessness for several years, I think there's a little bit of a sort of resignation to being homeless that will often occur with people. And street outreach teams can engage with people who fall into that situation in a much more proactive and strategic way. A couple things I want to emphasize about street outreach programs. Street outreach programs should be both proactive and reactive. So a street outreach team should be engaging with people on a day-to-day basis, going out to where there are people camping out, or there are people hanging out, people who aren't accessing services typically, and trying to engage with them, get them connected to services, or just build relationships with them. They should also be reactive. So a typical street outreach team will have an on-call number that citizens, business owners, people experiencing homelessness can call and respond to situations that are escalated, instances where businesses are experiencing behavioral issues or behavioral concerns out in front of their stores, and often these are things that are not necessarily appropriate for a police response or a medical response necessarily. A street outreach program is sort of that, before it gets to that point, a street outreach team can engage in a way that's much more sort of proactive, solution oriented, and I think ultimately effective. And so I just would emphasize that while a street outreach team will, generally speaking, spend the majority of their time interacting and engaging with people who are homeless, the constituents of a typical street outreach team are not just people who are homeless. It's the entire community. It's the business owners who are calling. It's the residents who are calling. It's the people who are homeless who are calling. And the idea is generally to make to create a community in which everyone has the opportunity to thrive and use and sort of use community spaces as they're intended to be used. I mentioned earlier that this is an opportunity to connect with people who don't go to shelters and day shelters, which means a disproportionate percentage of people who are chronically homeless. And what you see here on the slide, this is sort of a suggested staffing model for a street outreach team, having a behavioral health clinician, having a nurse, someone who, behavioral health mental health and physical health covered there, and then street outreach professionals, people who have been doing this work for often years, who are experts at engaging with the different constituents, people who are homeless, businesses, police, et cetera, who can kind of help navigate some of those trickier waters. One of the most, I think, this is the last thing I'll say, and then we can move to the next slide. One of the most notable things that street outreach programs can do or have done in communities where they're most successful is help people who are frequently engaged with costly community systems such as hospitals, jails, et cetera, connect to community resources and ultimately escape homelessness. And, you know, for individuals who are homeless, going to the emergency room every single day is both demoralizing, stigmatizing, and not the best form of medical care. And from a community perspective, it's also the most inefficient and expensive way to provide medical care. So street outreach teams are often able to reduce some of those big community costs. And in fact, all of the interventions we're talking about are able to reduce some of those community costs, but street outreach in particular because of who they're engaging with on a day-to-day basis. You can go to the next slide. So before we get into a couple of the sort of housing oriented and longer term solutions, I just wanted to explain a little bit about the Northern Colorado Continuum of Care. So the city of Loveland and service providers within it operate within the Northern Colorado Continuum of Care, which is a planning entity designated by HUD, by U.S. Housing and Urban Development, to oversee the implementation of homeless services across Larimer and Weld counties, and basically improve outcomes across the entire region. There are certain best practice interventions that continuums of care are expected to align with. Some of the big ones are housing, just launching housing programs. But in general, when you think of a continuum of care, the idea is that it's designed to improve coordination among members within that continuum of care. So I, as the representative of Homeward Alliance, cannot just go to the federal government and say, hey, can I have a grant for $100,000? The continuum of care goes to the federal government and says, can we collectively have a grant for $2.5 million? And we're going to decide as a region how to best spend that money and then report back to you on outcomes related primarily to housing. The continuum of care is responsible for a couple of big things. The first is the oversight of the continuum of care in general, which is a number of processes, but the big thing is submitting the annual response to HUD's notice of funding availability. So big grant application to HUD for federal funding, and then overseeing data collection and analysis within the region. This is called the Homeless Management Information System lead agency. That actually is Homeward Alliance within the Northern Colorado Continuum of Care. So we have a shared database. It's actually a statewide database with regional control for the 4 continuums of care that exist in Colorado. Homeward Alliance oversees the data systems for all of the agencies using HMIS within Larimer and Weld counties. And then you can see here that the Northern Colorado Continuum of Care is also responsible for the biannual point in time homeless count. And you can see here numbers from Loveland from the last few counts. Next slide, please. This is a list of current Northern Colorado service providers. You can see it's a pretty diverse group of agencies that are across the entire region. The ones highlighted in red are agencies that have either a full presence or some presence in Loveland. So it's a pretty significant number of agencies that are participating. And the majority of these agencies are using HMIS now as a data system, which is a key, which I'll talk about in just a second when we get to coordinated entry. Actually, you can go to the next slide and I'll just go right into it. So one of the key targets of a continuum of care is to create a coordinated entry system. Coordinated entry system is what it sounds like. There is no wrong door if you are experiencing homelessness, regardless of whether you engage first with a shelter in Fort Collins or you engage with a street outreach program in Weld County. You are going to receive an assessment using a common assessment tool. You're going to be entered into a common database. This is HMIS, and you're going to be put on a list of individuals sort of organized by the assessment scores on this vulnerability index that we used, and assigned housing resources collaboratively. So every week we have multiple case conferencing meetings for the different subsets of the homeless population, where we actually go through and we look at individuals on the by name list and assign them to housing resources according to their individual needs. A couple of key factors with any coordinated entry system: you have to have a tool for prioritizing individuals. It has to be low barrier, easy to access. There can't be prerequisites for getting into this system. It has to have an orientation on housing, it has to be person-centered. It has to use a standardized sort of process end tool. You need to provide fair and equal access for all subpopulations. It needs to be inclusive. It can't delay access to emergency services. It should be based on, it should lead to referrals. And again, as I mentioned, it should have a common data system. Next slide, please. So a couple of big picture solutions that we're going to talk that I'll talk about briefly here. Supportive housing. So supportive housing is a pretty broad term used to define define housing that has supportive services attached to it, just to put it as simply as humanly possible. So we have an example coming up in the community of Loveland. There'll be a picture on the next slide of the St. Valentine's Apartments, which is a 54-unit supportive housing project being developed by Catholic Charities. And basically, supportive housing projects are typically designed for people who are experiencing chronic homelessness, who are going to need support for an undetermined length of time, from, you know, as long as permanent, just depending on the severity of the disability that the individual is experiencing. There are lighter touch supportive housing programs where people, you know, receive services for a shorter period of time and then move on to, or maintain their housing on their own, or move into different housing. But in general, when we think of supportive housing, we're thinking of housing for people who are chronically homeless, have the highest needs in the community. You can go to the next slide and see the picture of St. Valentine's Apartments, the sketch of St. Valentine's. That's not a real picture, obviously, but that's the sketch. And then the next intervention, the other intervention we want to talk about, is rapid rehousing. So rapid rehousing, the reason it's important to note this is because there are different levels of needs among people experiencing homelessness. Rapid rehousing, while supportive housing is designed for people who have disabilities, who are chronically homeless, rapid rehousing is generally defined as short-term assistance for people who are not going to need assistance for a permanent period of time. It can be anywhere from 1 month of rent assistance, by definition, to up to 2 years of rent assistance, sometimes with supportive services attached and sometimes not. So where are we headed as a community? We are headed to the next slide, please. Our ultimate goal is to reach functional zero as a community. We don't use the word end homelessness. We say we want to reach functional zero, and that is an official term that means the average number of people who are homeless is no greater than the number of monthly housing placements. And the way to think of that is that we don't have people who are experiencing long-term homelessness, and the flow into homelessness roughly equates to the flow out of homelessness. If you go to the next slide, you can see some of the results that we've achieved as a region. We made enormous progress, almost have ended veteran homelessness across the entirety of northern Colorado. This is a reflection of resources and attention being directed to this specific subset of the population. But I would just sort of close my portion of this presentation by saying, I think it is a representative of what we can do with all populations if the resources and the attention is directed to those subpopulations. If we can do it for veterans, there's nothing to say we can't do it for individuals, families, and youth. I will close there.